So one of the factors as it relates to inflammation is actually stress. And, stress is one of those things that it's hard to quantify because in some ways we think that it's just an emotional thing. And that's really not true. So stress, it's not just emotional. There are really three types of stress that I think are really important. The first type of stress that we think about is that emotional stress or that perceived stress. And I know some of you, you may be kind of cool customers, and so you don't feel stress. You're not emotionally stressed, which is great, but there are other types of stress that you need to be on the lookout for. So the other types of stress are dietary stress. So for some of you, you may not feel stressed, but you may be dealing with dietary stress. How many people think you may be dealing with dietary stress? What do I mean by dietary stress? Well, there are things in your diet that you may or may not be aware of that is causing stress in your body and kicking off inflammation. What are some of the common culprits? Gluten, dairy, processed foods. And this one, which I know is a favorite of a lot of people, is actually sugar. Let's not get past the fact that sugar is actually inflammatory. So for some of you who are dealing with aches and pains, you're dealing with brain fog, you cannot figure out why, but you may be having wine every night, or you're having your cookies and ice cream every night, and you don't know why you're having all these symptoms. It may be that you're under dietary stress. So you may be putting yourself under dietary stress, probably in an effort to calm the emotional stress, right? Oftentimes we're doing emotional eating, but that emotional eating can actually make it harder on your body. So understand that stress is inflammatory. Third type of stress is actually pain in the body and the inflammation itself. So it's sort of like a vicious cycle. So for those of you who are dealing with chronic pain, what is one of the most common medications that you might receive? If you know meloxicam, if you know Celebrex, if you know ibuprofen, if you know Motrin, what do all of those medications have in common? They're all anti-inflammatories. So whenever you're dealing with any type of pain, say you have a joint pain and they tell you it's bone on bone, it's osteoporosis, you still have a component of inflammation there. That's why they give you anti-inflammatories. What is the best approach and the most natural approach to deal with inflammation in the body? The best way to do it is to look at where can you stamp out inflammation in every area that it's happening in the body. That is the way you deal with inflammation from the functional medicine approach.